Jess, the news of this plan is coming just as the CDC is saying that they expect life to continue as normal in the U.S. by late 2021. Here's what they're outlining in their new strategy. Vaccines are moving along fast and safely, said President Donald Trump in a tweet this morning on a day where the federal government also released its strategy on how to get a potential COVID-19 vaccine to all Americans. The nation's leading infectious disease expert, Dr. Anthony Fauci, has said it's unlikely but not impossible to get a safe and effective COVID vaccine by the end of October. The White House today giving new insight into what a vaccine would be like for people when it does eventually come. For most, it would require 2 doses, 21 to 28 days apart. The vaccine will be free thanks to billions of dollars in taxpayer funding approved by Congress and allocated by the White House. State and local health officials will be in charge of making plans to receive and distribute the vaccines. And the document even encourages local health agencies to review their 2009 H1N1 pandemic vaccination response plans and lessons learned. Kern Public Health explaining they are no stranger to organizing frameworks for mass vaccinations, telling 23ABC in a statement, while many people will remember the mass vaccination campaign that occurred in response to the 2009 H1N1 influenza pandemic, it's important to remember that public health and the healthcare community continue to do this every year for seasonal flu. While we do not have details on exactly how the COVID-19 vaccine is expected to be distributed throughout the country, we anticipate that public health will be involved in organizing, allocating, and administering the COVID-19 vaccine. The federal government says a massive information technology effort will also be needed to track who is getting which vaccines and when. The president discussing it during a news briefing this afternoon.
It's a great plan, and it's a plan like no other. And we can start doing it, I believe, the day that we come up with a vaccine.
When exactly a vaccine will be available is still up in the air, though. There are currently no approved vaccines, and at least 3 drug makers expect to know if their potential vaccines will work by the end of the year. But for now, the White House is making it clear they don't expect the wait to be long.
We're still of the belief that we will have a vaccine by the end of the year.
Public Health is holding a news briefing tomorrow morning. We'll be sure to clarify with them what their plan for a potential vaccine might be if it comes out in the coming months. But for now, here outside Kern Public Health, Austin Westfall, 23ABC, connecting you.